Module 7, Transportation for Older Adults. In this module, we'll consider strategies for assisting older adults in securing transportation. Keep in mind that those who seek transportation may fit into more than one of these categories. For example, an older adult who uses a wheelchair may be able to access resources meant not only for older adults, but also for people with a disability. As we go through this module, we will identify the transportation-related needs of and service strategies for older adults, as well as applicable funding streams. This increased awareness of older adult transportation needs will help you as a mobility manager work with partners on this issue, such as local area agencies on aging, councils on aging, and other senior services organizations. We have all heard about the graying of America, with a record number of U.S. citizens reaching retirement age in this and the following decades. Because the age of these older adults spans almost 50 years, versus about 21 years for youth, they are our largest age group, which means they have diverse needs. For example, older adults closer to age 60 are most likely still active in work and social pursuits, whereas those age 85 and above may be more frail and require specific services. Overall, however, older people today tend to be healthier and desire to be active longer than in previous generations. Here are some points about aging and older adults to bear in mind. Their geographic location, income, culture, and health and disability status, as well as working status, shape the transportation needs and preferences of older adults. More than 70% of older Americans aged 65 and older live in suburbs or rural areas. An overwhelming majority, nearly 90%, of people now over age 65 want to stay in their homes for as long as they can. Transportation is a top need for older adults, especially for those whose driving abilities have begun to diminish. 1 of every 5 persons over age 65 is a non-driver. On average, older adults who live past age 70 will need transportation services for at least their last 7 to 9 years of their lives. Specialized transportation is the only feasible mode for frail older persons, other than getting rides from family and friends. They will often need travel escorts and door-to-door and door-through-door assistance so they can continue to live independently in their own homes and stay connected to their communities. Lost mobility jeopardizes not only the physical and emotional health of the individual, who may feel a sense of loss and dependency, but also the quality of their community. What about older adults in the workplace? Because of the need to budget for increased longevity, the disappearance of guaranteed benefit pensions, and the need to work to rebuild savings lost as a result of the 2008 economic downturn, fewer and fewer people are expected to retire at age 65. More than 75% of workers ages 50 to 65 who indicated that they plan to continue working after age 65 cited the need for money as their major reason to remain in the workforce. And consider these facts. Nearly 25% of those ages 65 to 74 are still in the labor force. The U.S. Department of Labor projects that by 2014, over 21% of the labor force will be comprised of workers aged 55 or older. That's over 1/5 of the workforce. Furthermore, the Bureau of Labor Statistics predicts that the percentage of workers over the age of 75 in 2020 will have doubled from the 2000 level. Older unemployed workers tend to be unemployed longer than their younger counterparts. These unemployed persons are also likely to need affordable transportation to job interviews, job training, and work. Here are some of the considerations that pertain to older adults' travel needs more than they might to other populations. Older adults are more likely to work part-time jobs, particularly if they are over age 65. For example, in 2006, 16% of workers between ages 55 and 64 and 44% of those over age 65 worked part-time. The implication for transportation is that part-time workers often travel during non-peak hours and have work schedules that are less predictable than those of full-time workers. This means that finding consistent transportation may be a challenge for them. A larger percentage of senior trips may be to non-work-related destinations, such as medical visits, shopping, and social outings. Fixed-route transportation services to these destinations may not operate as frequently as those to employment centers. Older adults may have more concerns about personal safety when riding public transportation services than younger adults do. These concerns can be answered by furnishing public transit stops with waiting areas where riders will be protected from bad weather, seating, and bright lighting. Older adults are more likely to need low-floor buses, easy-to-access ride information and maps, accessible bus stops, and accessible walkways and safe intersections to reach the bus stop. Finally, older adults may welcome the opportunity for share rides to destinations, as they provide an opportunity for socializing with other older adults. The chance to socialize is often a great attraction to riding the public transportation bus. What type of transportation services can respond best to the travel needs of older adults? Consider public transportation first. Older adults, if they live where public transportation is provided, can and do generally use public transportation. The AARP reported that between 2001 and 2009, public transit trips by people ages 65 and over, as a share of all trips they take, increased by 40%. In 2009 alone, older adults took more than 1 billion trips on public transportation. The flexibility and freedom that public transportation offers to older adults are strong incentives for them to use it. They can go to the bus stop or station and get on. No need to make a reservation, and no need to tell anyone where they are going or why. Some older adults may use community transportation services because they cannot afford to own and maintain a car. Federal law mandates that on federally supported urban transit systems, adults aged 65 and over can travel during non-peak times at no more than half of the normal peak fare. The most frequently noticed limitation on the use of a senior fare is that it generally does not apply during peak commuting hours. Reduced fares may also not be transferable to adjacent transportation systems. For an example, an older adult rider may need a special coupon in addition to her or his ID card or pass to ride a bus service run by another jurisdiction in the same metropolitan area. After a few trips, most riders become familiar with and adjust to limitations and conditions that affect their travel. For older part-time and occasional workers, paid and volunteer, who travel to work outside rush hour, the reduced senior fare can be just the ticket. Some systems, such as those in Pennsylvania, allow adults aged 65 and older to ride for free. Systems providing free or discounted rides to seniors usually require them to obtain an ID card or special pass to access senior fares, although some will accept a Medicare card as proof of age. Area residency is also often a requirement to obtaining a pass for local transportation services. These passes or cards are usually valid for only a certain length of time, but often can be renewed. Many providers require a filing fee to obtain a card or pass, and some charge a renewal fee. Many rural systems also choose to offer reduced fares to older adults. Of course, older employees are eligible for the same employment-related transportation benefits that younger commuters have access to at work. Some older adults may not consider taking public and other forms of community transportation until circumstances force them to limit or give up driving their own vehicle. For adults who have never used public transportation before, this can be a step into unfamiliar territory. Some form of travel instruction to familiarize older adults with how to use the local transit system is often sufficient. Your transit agency may already offer videos on how to ride. For example, the Transit Authority of River City in Louisville, Kentucky, AARP, the Kentucky-Indiana Public Development Authority, and the Area Agency on Aging partnered to produce a travel instruction video that teaches seniors and others how to ride. Transit agencies may also provide in-person travel instruction, either at the agency's site or in a common gathering place for older adults, such as senior centers. If the agency does not offer such a service, ask if it will consider providing it, as it can increase the likelihood of older persons using regularly scheduled transit. Travel instruction can also decrease the number of older adults who use ADA paratransit, a service that is much more expensive to provide than regularly scheduled transit. One particularly successful travel instruction program is the Bus Buddy program offered at Lane Transit District in Eugene, Oregon. Operating for almost 15 years, the Bus Buddy program teaches older adults who are unfamiliar with the public bus system to ride with confidence. Bus buddies help their partner plan trips and navigate routes. They ride the bus together, allowing the new rider to learn how to pay the fare and safely enter and exit the bus. Afterward, the bus buddy answers any remaining questions about using the transit system. In exchange for volunteering, each bus buddy receives a free pass for each month they provide assistance. Their efforts are also recognized at an annual event. Other older persons, such as those who use mobility devices or have poor vision, may need more intensive travel training. This type of travel instruction is designed to teach people to safely navigate their community, including using available transportation services. It can last from one session to many sessions. This one-on-one service can go a long way toward increasing an older adult's confidence in using public transit, which in turn allows them to travel more independently around their community. Another way to encourage older adults to use available transportation services is to ensure they know about them. Transportation providers should consider discussing senior transportation options at many senior activity centers and during public meetings to which older adults are invited. For example, in Montgomery County, Maryland, the Jewish Council for the Aging has invited representatives from public, private, and volunteer transportation programs to present information about available services to Senior Community Service Employment Program, or CSEP, participants at meetings. During efforts to publicize the availability of services is also an excellent opportunity for transportation providers to encourage seniors to consider how they will get around when they stop driving. For example, older and low-income workers alike may benefit by learning about the savings accrued by using transportation as a supplement or replacement to a family car. Transportation providers can also emphasize the safety, reliability, and convenience of using public transit or other forms of ride-sharing. Also, by listening to older adults' comments, they can consider making adjustments to further enhance services to meet these riders' needs. For example, to accommodate part-time older worker schedules, they can create services that feed into or augment public transportation routes during non-traditional commuting hours. They can design routes that connect senior housing areas to employment sites and transportation hubs and allow flexibility in their routing and scheduling. For example, in St. Augustine, Florida, the Sunshine Bus Service, which serves older adults and the general public, allows passengers to flag down buses at any corner along the routes. Another incentive to encourage older adults to feel comfortable using public transit is a guaranteed ride home program that gives them a way to return home when emergencies arise. Seniors can also work with transportation providers and local officials on needed improvements to their facilities to address older riders' concerns, such as providing better lighting, improved access for pedestrians and people with disabilities to bus stops, shelters at as many stops as possible, and easy-to-read route maps. Frail older persons and those with severe mobility impairments need special transportation services. They can become eligible for demand response services in their community through their local transit agency. Well-trained volunteer drivers are also a good option for them. How are transportation options for seniors funded? In addition to funding for general transit services, Section 5310 funding, also known as the Formula Transportation Program for Elderly Individuals and Persons with Disabilities, has been the primary source for public and, in many communities, private nonprofit organizations to secure vehicles and other capital items to serve older adults. Section 5310 funds have been used primarily for capital purchases or to contract for services. There are now changes afoot with the passage of the new 2-year Transportation Authorization Bill entitled Moving Ahead for Progress in the 21st Century, or MAP 21, signed into law on July 6, 2012. In the legislation, the Section 5310 program was broadened to allow other activities to be funded: operating expenses for services, improving access to fixed route transit service, and creating alternatives to public transportation for seniors and persons with disabilities. 55% of Section 5310 funds must be used for capital expenditures. The remainder are eligible to be used for these expanded purposes. Mobility management is still an eligible capital expense under the new Section 5310 program. Contract revenue from social services, including those social services federal funds, continues to be allowable as a portion of the non-federal share of transit projects in Section 5310 projects. As under the older Section 5310 program, any projects funded under this section must be based in the local Human Services Public Transportation Coordination Plan. Learn more about this type of plan in the module on creating new services. What are some other publicly funded senior transportation programs? In rural areas, general public transportation is provided by a nonprofit human services agency, such as a council on aging or an area agency on aging. These agencies also provide meal deliveries, grocery shopping, other social services, and volunteer driver transportation programs. The area agency typically receives transportation funding from Title IIIB of the Older Americans Act to provide the services, and from Section 5310 funds for the vehicles. Transportation providers, usually in rural areas that receive funding from the Older Americans Act, are not allowed to charge for services, although they can ask for donations. For example, the HOP, a transit system operated by Hill County Transit District in Central Texas, operates on the honor system. Riders do not need to show an ID. A sign notifies riders that anyone 60 or over does not have to pay a fare, but can make a donation. Some federal initiatives have funding to provide transportation as a support service for their program participants. In many of these programs, transportation costs are covered as a support service for employment training and placement services. Some federally sponsored volunteer programs also provide reimbursements for transportation costs for older adults, making it possible for people who would not otherwise consider volunteering to do so, and providing local agencies and organizations with an additional pool of volunteer support. Here are some examples. The Senior Community Service Employment Program, authorized by Title V of the Older Americans Act, provides grants to states and national nonprofit organizations for subsidized employment and related services for adults aged 55 and over with limited income. A portion of project funds may be used to provide participants with training, counseling, and other supportive services, including transportation. Through its Senior Corps division, the Corporation for National and Community Service sponsors 3 older adult volunteer opportunities, each of which provides transportation reimbursements to senior volunteers. These programs are the Foster Grandparent Program, the Retired Senior Volunteer Program, and Volunteers in the Senior Companion Program. More information on each program is available in the resources posted with this module. Often, older adults take the initiative to develop services for their peers. Volunteer driver programs, in which younger older adults drive more senior adults to community destinations, began this way. In many communities, volunteer driver programs are the backbone of transportation for older adults. The main issues that volunteer driver programs have to address include vehicles, owned by volunteers or programs, insurance for drivers, volunteer recruitment, and maintaining quality, safety, and dependability of the service. A comprehensive resource list of guides for beginning and operating a volunteer driver program can be found at the Community Transportation Association's Senior Mobility web pages at ctaa.org/seniormobility. The Beverly Foundation is also a valuable resource for all aspects of volunteer transportation. There are several different models of volunteer driver programs. Services provided free or for a suggested donation is the standard and most widely used model. The TRIP, Transportation Reimbursement and Information Program model, is where an older person finds his or her own volunteer driver. He or she submits documentation of trip expenses, and the sponsoring agency reimburses the older adult, who then pays the volunteer. This model, which is relatively simple to administer, was developed by the Partnership to Preserve Independent Living for Seniors and Persons with Disabilities in Riverside, California. The barter style, or travel bank system, is another model in which an individual exchanges one ride for another or saves up driving points. Some 55-plus communities have developed a barter-type service through which they trade off taking each other to airports, train stations, stores, etc., or accumulate points for providing rides that can be exchanged for future trips. The best-known example of the barter-style model is Partners in Care in Anne Arundel County, Maryland. Another model is the ITN America program, in which older adults who can no longer drive donate their used vehicle to the program in exchange for access to the volunteer driver network for trips within the program's service area. ITN America charges an annual membership fee for use of its software and other components of this model. Yet another community example is the Beacon Hill Village in Massachusetts. Resident older adults pay annual dues in exchange for an array of nursing and personal assistance care services that range from medication management to transportation assistance. Although the latter two types of programs, exchanging services or vehicles for rides and paying an annual fee for services, will benefit many older adults, they are probably out of the reach of older adults with limited income and or who no longer drive. For them, the no-fee agency or volunteer services can be a lifeline, without which they would remain isolated in their homes. What about private services? Sometimes, to attract new customers, local grocery stores will provide public transit passes to older persons. A number of years ago, Ralph's in San Diego co-sponsored with the AARP and a local public transportation provider a travel instruction program using AARP volunteers as travel ambassadors. Wegmans, a New York-based grocery chain, provides transportation from senior centers to its grocery stores in Rochester and Syracuse. Buses with wheelchair access are dispatched to 70 senior-subsidized housing complexes and transport residents to a nearby Wegmans store to do their shopping. Store employees welcome them and assist them with their shopping needs. These same buses return them safely home. Open only to seniors living in government-subsidized senior housing, this program is provided at no cost and is 100% funded by Wegmans. Finally, let's look at maintaining access to a private vehicle. Private vehicles are also a part of a community transportation network. In an ideal world, public types of transportation would take you to every corner of your community so that you would need a private vehicle only for long-distance trips or rare reasons. However, we know the reality is that public transportation's reach is not that widespread. So, while we continue to support efforts to expand public transportation options that provide affordable trips to all parts of the community, it is important to also look at those options that help people use private vehicles. AARP has sponsored 2 programs that help older adults continue driving safely: the AARP Drive Safety Program and CarFit. The Drive Safety Program is a refresher course for drivers age 50 and over. Those who take this course may be able to receive a discount from their private insurance company. It is now provided as an online course as well as classes in communities. The CarFit program, created by the American Society on Aging in collaboration with the AARP, the American Automotive Association, and the American Occupational Therapy Association, helps older drivers, and indeed anyone, make sure their car settings still fit them. An occupational therapy practitioner may demonstrate and recommend adaptive devices that can help drivers find their best fit. In this module, we've identified many agencies that mobility managers can work with to assist in connecting older adults with transportation services. Please view the many resources and links to expand your learning beyond this module. Thank you for your participation.